welcome to all of you. I'm so glad to have you here today. My name is Katie Chicoyan. I am the epidemiologist with both the Strategic Prevention for Technical Assistance Center and the Prevention Technology Transfer Center for HHS Regions 6 and 7. I am thrilled to have you all joining us today. And in a minute, I will introduce our co-presenters with you as well. They are really what I'm excited for you to be here today. In our hour together, we're going to be talking about understanding state preemption and local opportunities in alcohol policy. Before we start, I just want to get a couple of disclaimers out of the way for you. So as I mentioned, this is a collaboration between SPTAC and the PTTC. SPTAC is supported by a contract from the U.S. Department of Health and Human Services through SAMHSA and CSAP. The views, opinions, and content expressed in this product do not necessarily reflect the views, opinions, or policies of CSAP, SAMHSA, or HHS. Similarly, the opinions expressed herein are the view of the PTTC network and do not reflect the official position of the Department of Health and Human Services or SAMHSA. There is no official support or endorsement of DHHS, SAMHSA for the opinions in this presentation. Additionally, because SPTAC is a contract of SAMHSA, the language that we use here will be in accordance with the current administration and executive orders. As we jump in, so this webinar today is being recorded. We do want to hear from you all, so feel free, please, to come off mute to speak any comments as we're going. You also can type your comments or questions into the chat box. We additionally have a Q&A box set up today, so anything in the chat everybody can see. There'll be a few times throughout our time together when we ask you all to share something in the chat. But anything in the Q&A box will go directly to your facilitators, and we can answer those either out loud as we talk, or we'll put an answer directly in that Q&A box for you. Finally, at the bottom of your screen, you will see that there is a raise hand option under the reactions, and again, that's where your mute button is. Today, what we're hoping you all will take away from this is that you will be able to describe the concept of preemption, that you can articulate a process for identifying local policy interventions that do not conflict with state preemption, and that you will be able to utilize our new preemption and alcohol policy fact sheets to identify local policy interventions and solve local alcohol-related problems. And we will be sending those fact sheets out to you all at the end, or just following this webinar as well. Now, I'm very excited because I get to introduce you to our co-presenters today. So first, we have Michael Sparks, who is an alcohol policy specialist, community organizer, and the president of Sparks Initiatives. His primary interest is assisting communities to implement evidence-based upstream strategies to address factors that impact community health. Among others, Michael is currently working with the Wake Forest University, City of Miami Gardens, Florida, the Pacific Southwest Prevention Technology Transfer Center, and the South Southwest Prevention Technology Transfer Center, as well as the Substance Abuse Mental Health Services Administration, on a range of public health issues. He currently serves as the co-chair of the Scientific Advisory Board of the U.S. Alcohol Policy Alliance. And with him, we also have Ryan Treffers. Ryan is, a research scientist at the Pacific Institute for Research and Evaluation and the Prevention Research Center. He is the director for PIRE projects that include the Alcohol Policy Information System, APIS, and the Report to Congress on Prevention and Reduction of Underage Drinking, the STOP Act, as well as a current member of the Advisory Board of the United States Alcohol Policy Alliance, USAPA. We are thrilled to have them with us today. Before I hand it over to them, just a quick overview of what we're going to be spending our time on. We're going to start by exploring the concept of preemption. Michael will help us situate the preemption analysis in larger policy work. Then we will be introducing those preemption and alcohol policy fact sheets, and finally using preemption analysis to revise local policy intervention approaches. Without further delay, let me pass this over to Ryan.
Thank you very much, Katie. And welcome everybody. So now preemption. I hope by the end of our presentation you have a basic understanding of what preemption is, how to use the fact sheets that we've developed to assist you, and why preemption need only be a consideration to improve public health in our communities, specifically when starting work on alcohol policy. As I provide an overview uh, on preemption and its potential for impact on crafting local policy in your communities, we'll be posting a poll asking several questions, testing your understanding of the concept as I work my way through this portion of the presentation. So, what is preemption? Preemption is a legal concept holding that laws and regulations made by higher levels of government override those made by lower levels of government. Generally speaking, in the United States, the highest level of government is the federal government, followed by state government and then local government. Unlike other areas of policy work, especially in public health, alcohol is different. The reason for this is the 21st Amendment of the United States Constitution, which largely hands the regulation of alcoholic beverages to each state individually. So when working in the alcohol policy field, largely at the local level, you're looking to what the state says you can and cannot do, or what you think you can, or, rather than needing to go all the way up to federal law. Uh, so this makes things a little bit less complicated and a lot more room for work both at the state and at the local level. Ultimately, one thing just always to remember when thinking about what is preemption, it means who gets to dictate and decide what policies are in effect for our communities. So when it comes to public health and preemption is not always a challenge for people and organizations working to promote public health. One of the reasons for this is that preemption, or more precisely, the concept itself, on its face is not inherently good or bad. Rather, it is the context within which it is being used that will determine whether it functions as an important tool or a barrier for promoting public health. What it ultimately does is it prevents a patchwork of local policies, or in the context of federal preemption, a patchwork of state policy, patchwork of state policies. In some contexts, this is a good for public health. An example where preempting local action is overdose preemption. Good Samaritan laws provide legal protection to individuals who voluntarily assist someone who is injured or in danger, encouraging bystanders to help without fear of being sued for unintentional harm. A state level law allowing persons to administer Narcan anywhere in the state is a preemption of local action. In this context, is a good thing from a public health perspective because it enables a person to take action without needing to necessarily know what the laws are in their state. They don't need to, or rather, know the local laws. I don't need to figure out what city I'm in. Does this city prevent me from being sued if I, in good faith, administer Narcan to somebody in need of it? On the flip side, there are many examples, specifically in the tobacco control space, which many people are aware of these, of industry influencing states to preempt local action, such as local clean air regulations or prohibitions on cigarette vending machines. Even in the context of alcohol, alcohol hours of sale is a policy that can cut sort of both ways. For example, if the state sets the hours, it could be bad for public health. For example, if you have bars that are open late and you'd like to have them closed earlier, and you may be preempted. On the flip side, if say your bars close at midnight and the locality you're in wants to extend the hours, that the preemption actually is good for public health. So it really depends on what context you're looking at. So now let's briefly talk about some of the ways you can determine whether a policy you're considering is an option for you at the local level, and some of the things to do if you're told that it's preempted. First, a good starting point in the alcohol policy field will be the fact sheets that we'll be sent later today, and we'll be discussing a little bit more specifically shortly. Next, know this: preemption is not presumed, meaning there's no that there's no affirmative, rather meaning there needs to be an affirmative policy by a higher level of government that specifically preempts local action. There's no blanket statement or presumption that localities can never do anything about alcohol ever. Uh, Further to that point, if a local alcohol policy is implemented and challenged in the courts, it will be reviewed on a case-by-case basis, meaning the individual facts of it will be reviewed, the specifics of the local law analyzed to see if the policy is specifically preempted. Again, there's no general rule that a locality can do nothing about alcohol. Next, when trying to determine whether a particular local policy initiative is preempted, one of the best starting points is to just look and see what other communities in your state have done. Sometimes, that this is a quick and easy way to determine if you see a policy that you would like to implement. The fact that they have it in their jurisdiction within your state is a very good, very strong indicator that you would be able to do that and it's not preempted. When working on policy, there will often be pushback, and preemption often will be thrown out there as the reason. It's a quick and easy thing to say, hey, you're preempted. You can't do that. It shuts down conversations and, avoids deeper analysis. When, working in the local, looking in the policy arena, a good question when presented this is just to follow up. What says that we are preempted? That you want a law, you want some affirmative statement by the higher level of government in the context of alcohol. You want the state to say, no, we preempt that. And so that's an important thing. And then lastly, even when faced with that, if someone turns around and says, yes, you are preempted, and you are, there's still ways to pivot around that. A brief example of this is social host ordinances. There are a few states in the United States where localities are specifically preempted from establishing local laws prohibiting underage drinking parties on private property. Instead, the state, in those cases, the state typically does this because it has its own policy. It doesn't want a patchwork of policies. At the same time, though, it's not uncommon for state policy to be insufficient in certain localities. So what can a town do? What can a city do that wants to address the problems associated with underage drinking and the social host law isn't working? Well, they can try to pivot around it. And this is done, for example, one way is to indirectly come at the issue of underage drinking parties. And that's to say, look to other authority that the locality has and address other issues that are associated with it. Commonly, when you have underage drinking parties, there's other problems that flow from them. You have, loud music, you have fights, you have graffiti, a whole range of problems that are in addition to the underage drinking. When you're preempted, it's with regard to a very specific thing. You can't say there's no, sort of no furnishing of alcohol to underage persons in this property, but you could use your nuisance powers to address all those other attendant behaviors and create, say, a loud and unruly party ordinance. So in that way, you've sort of pivoted around the main preemption issue. So now before I hand things over, though, to Michael, let's quickly review go through our poll here and get some responses. I will then quickly give the answers as well. So, and then also too, well, after you answer this, one thing I'd also just like to hear from people, if you could drop in the comment, what's a policy or some policies that you at the local level are considering in the realm of alcohol policy? Love to see what you guys are thinking about out there.
Yes. So as you finish up the poll, and it looks like we're slowing on responses, if you could put into the chat just what are you thinking about in terms of policies or even issues that you'd want to address around alcohol, and we can come back to those a little bit later in the webinar as well.
And say it looks like numbers are slowing down here, and actually I think I'll start from the bottom with regard to the first one, or rather to number 3, as everybody answered the same thing, and everybody is 100% correct there, that yes, when trying to determine whether or not a particular local policy initiative is preempted, a good starting point is to look to see what other communities in your state have been able to do. That's, yeah, I would say it should have actually on this slide probably been my first bullet point there. It's such an important one, good starting place. So now I'll jump back up to option number 1, or question number 1. Preemption is a legal concept holding that laws and regulations made by higher levels of government override those made by lower levels of government, and that is true. So, and lastly here, the question is, preemption is always a challenge for people and organizations working to promote health, public health. I would say it's not always a challenge. This is a bit of a trick question. It's not always a challenge necessarily. In some instances, it's actually could help you. But it should always be, the answer there would be, it's always a consideration, but it's not necessarily a challenge. So the answer to that one would be false. So, but thank you everyone for your responses. And with that, I will hand things over to Michael Sparks.
Thank you. Now I've just got to get my my mouse working.
Let me help
Okay,
you
Kate.
out there, Michael.
Yeah, thank you.
No problem. There you go. You should be good to go.
Okay, so thank you, Ryan. There's been a lot of talk about preemption and preemption around a particular policy that you're thinking about. As we were looking at devising and developing this framework around how we were going to talk about these in the fact sheets, it was clear to us that we needed to give you a context in which to put this whole preemption analysis notion. And so on the slide you have in front of us now, we thought through what we might consider to be a readiness to do actual local policy work. And if you look at this flow chart, if you will, you'll note that the preemption analysis occurs, 4 steps into the process. But even more importantly, all this is done before you actually begin working on the policy campaign. And a number of you, I've seen your names, I know you're here, have seen and have used the 10 policy step process as a way to enact local and state level policy. So there's quite a bit of work that goes on prior to actually beginning to do the policy. This first piece then is to really understand that in order to get to a place where you've identified a policy, you need to know a lot about your community. You really need to understand this. Let me see if I can go to the next slide. Yes. So I think most of you are familiar with the SPF, the folks who are on this call and on this webinar. And as part of that strategic prevention framework concept, there is a process of going through and developing a strategic plan or a community assessment. And to arrive at a problem that your coalition or your group wants to work at, we often rely on looking at the prevalence data, what we consider the 5,000-foot high-level data. And this, in a sense, this gets us into the right field, if you will. So when I've looked at strategic plans or community assessments, frequently they'll come up with, well, our primary problem in this community is underage drinking. We have high rates of underage drinking, or we're seeing excessive drinking with young adults that are occurring between the age of 21 and 26, or we have very, very high DUI rates. This is an important first step of the process of actually moving towards identifying a local policy. But when you're looking at problems that are framed this broadly, the policy work that you need to do isn't quite yet available to you. What's the policy you're going to work on to address underage drinking rates or excessive drinking? We don't know yet. You know where you want to be. You know whether you want to play perhaps soccer or basketball, but you don't know which of these is the most severe in your community and which way you want to move in terms of developing local policy. Next slide, please. So the next step in this process, as you increasingly move to identifying a policy upon which a preemption analysis can be conducted, is thinking about, well, we've established that we've got high rates of underage drinking, we should do something about that. Or we've established through our community assessment that we need to focus on excessive drinking, binge drinking, with young adults. But the question then becomes, well, where is this behavior occurring? Where are the highest risk settings that underage drinking or high risk excessive drinking is occurring with young adults? Where do we see that happening? We call this data the 1,000-foot level data. It's a step down from the prevalence level data at the 5,000 foot, and brings us into really identifying where is the greatest risk occurring in the community. Maybe if it's excessive drinking with young adults, it's happening in bars in entertainment district. I did see a comment in the chat that came up earlier about people wanting to focus on their DORAs, and this whole growth of downtown entertainment districts post-COVID has been fueled by the availability of alcohol, mostly at on-premise establishments like bars and restaurants. And that's created a certain number of problems that occur. And that may be where, as you're looking at where your highest risk settings are and collecting data about this, that may be where you land. You say, well, it's not all bars. The bars that are creating and contributing to these high rates of excessive drinking with these folks are really in our downtown entertainment district. Or perhaps if you work in a college community, it's in that area where the college bars are located. Maybe special events, but special events, is it all special events or is it just a few special events? And when we're talking about home parties, underage drinking may be that the most problematic areas are at home parties. Question is, where are these home parties happening? In my own community here where I live, when we did this analysis around where is underage drinking occurring and what are the highest risk settings, our first data came back saying, well, it's parks, beaches, and homes. And it took a lot of work to really decide which of those was the most problematic. Turned out it was homes, but we needed to engage in that collection of additional 1,000-foot level data to understand that. Next slide, please. Once you have a sense of what you want to work on, let's just for a moment, Ryan used the social host example, but for our purposes, let's look at this notion of excessive drinking in entertainment districts or in bars. You really want to begin to do a deeper analysis. And I want to give credit to CADCA for this notion of a local condition. I'm sure many of you have been through the academy or have been through CADCA training where they talk about this notion of a local condition. It takes this 1,000-foot level data and really hones in on, okay, it's downtown, it's these bars, but is it bars all across downtown? Maybe it's between 5th and 9th Street. Maybe it's in a specific district, maybe that is geographically bound. We want to know where. We also want to know what's happening. Is it happening on Thursday nights, Friday nights? Are people pouring out into the streets when the bars close and getting into fights? Or do they have music outside and that outside music is drawing people in and they're drinking in the streets where they shouldn't be? I mean, we really need to understand what we would consider a local condition. And by getting a more detailed analysis and understanding of what's happening, which often requires you, if you can, to go to those settings and do the observations, or certainly at least talk to people, you can frame your local condition in a way that makes it actionable. An actionable local condition sets up the identification of an appropriate policy upon which then a preemption analysis can be conducted.
Michael,
yes.
May I just jump in right there? I say on
Absolutely.
that point about on that preemption analysis and everything also that you're describing here, just to add in that this is, the work that you're doing in this piece will also serve a purpose in, I say, the next slide that Michael will show, but I'm sort of jumping ahead a little bit here, but just to say, when going back to the bit about the preemption analysis, that it's specific to the facts that and the policy that are implemented and specific to that community. So if you're challenged, all of that data you've collected will enable you to work on a policy that, if you think you're being preempted, that it enables you to pivot around it. So that all of that analysis and all of that work serves dual purpose, both in helping identify policy as well as to make sure that the policy is sound from a legal perspective. So
thank you, Ryan. That's absolutely true. So you've got an actionable condition. You're working on these excessive drinking in this downtown area. Now the question, and you understand a lot about what it looks like. Maybe they're over-serving in bars. Maybe they're not over-serving in bars. Maybe the problems that are occurring downtown are because people are bringing in the alcohol from the outside, whatever that looks like. This is the setting where these problems are occurring. Now the question is, well, what's the appropriate policy? What do we do about this? We have an actionable condition. We decide we're going to work on this, not that. We understand the this, not that. We know what it looks like. We know when it happens. We know who's doing it. We have a lot of information. So where do you go to find out what to do? Where do you go to find out what works? And you can see on this slide, there's some examples of places that have been provided to essentially recommend evidence-based policy interventions. Alcohol, no ordinary commodity, from my perspective, is the most comprehensive compendium of what works and what doesn't work. It's a long book. It's great for reading when you want to go to sleep, but it's there and it's all included in and provides a rationale for each of the strategies that are effective. You also can get this from the state performance document on the left-hand side of the slide. And then the World Health Organization, although it's a European, represents the European community, many of the same policies that we're interested in, the World Health Organization has done research and recommends around based on their analysis for the European countries. And then finally, another valuable tool is the community guide, which is connected to CDC. All of these documents can tell you something. They can tell you, well, for example, responsible beverage service or server training is a marginally effective program. It's much more effective, for example, if you make it a mandatory policy that everybody has to do it 4 times a year, whatever that looks like, and you couple enforcement with it. But what does that look like in your own community? Now you're in the place of saying, well, you know what? We did decide that downtown, the problem was that people were over serving in bars. They were just continued to serve people after they were obviously intoxicated. And what they need is to better understand what the laws are and how to learn to not serve someone who was continually asking. So they need RBS or server training. But at that point, you've got your policy. You want to do a local server training policy. This is where we begin to look very carefully at the next phase. You want a server training program. You've done what we would consider the research on what works with server training. I'm moving slides. You know that it needs to be, if possible, in person, 3 hours. It has these components to it, so on and so on and so on. Now the question is, can you enact a local policy that will allow you to do server training in your downtown district or wherever it is you want to do it? And this gets into then conducting the preemption analysis. The first thing I would be looking for, as Ryan suggested, is I'd look around at other communities across the state. Has anybody enacted a policy locally in their county or their community, in their city, in which they had built a server training program? If so, there's a pretty darn good chance that it's not preempted by the state and you can do it yourself. So this then becomes a sort of green light for you to begin moving towards the actual policy steps to begin the work on, adopting a mandatory RBS program in your community. But let's say that the state has an RBS program that they offer to bars and restaurants. And let's say that, it's a 20-minute online checklist. It's not evidence-based. It's not going to work, honestly. And so you want to now determine if there's something we can do. Our perfect model isn't going to work because it's preempted. So what other options do we have? And that next step then takes us to the pivot that Ryan was talking about. I honestly believe that there's a workaround for every preemption kind of problem that exists. It's what we often call the cracks in preemption. No, you can't do that server training program because the state occupies the field. Oh, but it turns out that you may be able to do something online as long as you register it with the state. Okay, it's not what you originally wanted, but if you register it with the state, you can offer one yourself and you can make it mandatory. So there's this process of pivoting is really about how do you identify a policy that you can begin to work on that gets you as close as possible to an evidence-based strategy that was written about in one of the various manuals or compendiums that I showed a couple of slides ago. And if you can't, if there's no way you can do it, for whatever reason, then you may have to pivot again and say, well, our second highest risk problem in this community was underage drinking. So we're going to do a social host ordinance, whatever that looks like. So this process of getting into the preemption land is a consideration. It's not a stop sign. I mean, occasionally it's a stop sign, but most times it's not a stop sign, and we're looking for ways to move around the preemption or get through a crack in the preemption. And that's when we actually move towards revising our local policy, which takes us now to the final slide of this piece and a full description of the process. So here's where this begins. Through your community assessment, you identify a high-level problem, excessive drinking, 21 to 25-year-olds. You look for the highest risk setting. You collect what we call setting data, or 1,000-foot level data, and you're really now understanding, okay, the highest risk place isn't homes for those people. It's downtown in this entertainment district. You get more detail about that setting. You spend time down there. You collect calls for service information. You talk to people who may go to those locations. You do participant observation and view what's happening in those bars. You collect a lot. You create an actionable local condition, which then sets up the policy response. The policy response then goes through a preemption analysis, the way Ryan talked about, and the fact sheets will become valuable here. You may need to pivot and revise that policy or shift to another one. Once you settle on your policy, you move into initiating your 10 steps of the policy campaign. All right. And the policy steps then look like, many of you have seen this, that looks like this. And so all of that works gets you to step 1. And then step 1 takes you all the way through step 10, begins the process of taking you through step 10, where you actually adopt the policy, get the policy implemented, and evaluate whether or not the promises you made to the community in terms of reductions in problems are actually happening. All right, with that, I think we're going to go into questions and answers, if there are any. So Katie, are you seeing anything, or Wanda, any questions that you all are seeing?
No big questions, but I did want to share some of the topics that folks are looking for.
Yeah, that'd be great.
So I scroll through the chat, I'm seeing social host is definitely something that folks are interested in. As you noted, Michael, the DORAs, we want to work on the DORAs that were passed at the state level. More social host. Increasing sales tax and tightening restrictions on how the sales tax money can be used. Performing the RBSS trainings across the state and forming a refresher training as legislation changes a vendor's responsibilities. And I think those are the big ones that have come through.
The sales tax one's interesting because that generally localities have the authority to levy sales taxes, and Ryan will certainly have more information on this. But when it comes to alcohol, they sometimes get a little nervous about that, and that's controlled at the state level. But it'll be interesting. Once again, depends on what state you're in and what kind of control you have to do that. But I'm glad someone mentioned price, because price is the most affecting the price of alcohol, just like tobacco and cannabis and others, dictates very strongly consumption levels, and that dictates rates of problems. So working on price, whether it's through taxes or happy hours or something else, is a very important strategy for communities. So I'm glad somebody mentioned that. Okay.
Are there any other questions right now before we jump into talking about the fact sheets themselves? And I'm sorry, Ryan, I cut you off.
No, that's okay. No. So
can I answer this question that just came up from Trevon? The question was, how long does it take to do the 10 policy steps? And policy can happen very, very quickly. You can decide that a mandatory RBS program is not preempted, and you find a champion on the city council, and that champion drives it through the city council, and 2 months later, you've got yourself a new policy. And while that's attractive and interesting, and people think, oh, wow, that was so successful, when we talk about doing policy work, 50% is getting it adopted and 50% of it getting it enforced or complied with or implemented, depending on what it looks like. If you get a policy done too quickly and you haven't done the community organizing and the mobilizing and the community awareness, then there's no pressure for the body who is responsible for enforcing it to actually enforce it. There's no pressure point. There's no backstop. The wind at their back to get it done doesn't exist. So while it may take longer, the process of going through the 10 steps in some deliberative manner will increase dramatically the likelihood that your policy will get adopted and work. I think, I say this very loosely because it can be more time or less. But if a community can get to the place where they are identifying, going through this readiness stuff is, important. But from the point at which you get to number one, step one, to the point you get to number 10 can take a year if you do it well, particularly because you all have other work to do. This isn't the only thing you're working on.
I'm seeing amazing, Trevon. So you have the mayor 2 doors down from your office and the police chaplain on the coalition. It sounds like that community building and partnerships is really underway for you.
It's great to have those grass top supporters. At the end of the day, the people who are going to push your policy across the finish line are your residents, the grassroots folks. Keep those in mind.
We did have a question come in through the Q&A for you, Michael. And the question is, can you offer any advice on how to ensure that local policies are fairly enforced? Thinking specifically about noise ordinances, how do you avoid unintentional negative impacts? And also a note that if that feels like it derails our conversation, we can have that conversation at another time.
I mean, we can have the conversation anytime you want. Let me just say very quickly that every one of these 10 policy steps that are on the slide before this has associated with it a set of considerations that help ensure that communities that are disproportionately impacted these problems and other things are effectively managed at the front end. And so selecting a policy, like Ryan mentioned for social host, that sometimes you have to pivot to a nuisance ordinance because the nuisance ordinance isn't preempted where the social host policy that specifically deals with drinking is preempted. And so the first question will come up is like, well, do we want to do a nuisance ordinance in here? They have a pretty bad reputation in terms of, how they've been implemented. And certainly what we can do is provide you with the considerations, the range of considerations associated with each of the 10 steps that, if carefully looked at and talked about with your coalition, I think will dramatically decrease the likelihood that the policy you adopt will be unfairly enforced or unequitably enforced or unjustly enforced. So, if you want that, send somebody a note and I'll make sure that stuff gets to you.
And then we have one more, and then we can maybe move forward towards the fact sheets. But can you talk more about securing the meat of what you want to accomplish while needing to pivot? So what are the ways to protect that while you're working with those who hold power negotiations? Let's see.
Great question. Every policy has as its bedrock foundation a set of scientific principles that make it work. And at the heart of many of those principles, or many of the policies, is this notion that if you increase the availability, let's just say of alcohol, you will increase the consumption of alcohol. That could be in your house, it could be in your neighborhood, it could be in your community, it could be in your state. The availability of alcohol is a dramatic variable in driving the consumption of alcohol. And the higher the rates of consumption, the higher the rates of alcohol-related problems that we're all trying to address. So when you're thinking about working on these policies, you're really thinking about, this best practice policy over here clearly addresses, the availability of alcohol. We've just put in a new alcohol outlet density ordinance, and that density ordinance mandates that we have 2,000 feet between new outlets. And that means that over time, we will see fewer and fewer outlets in our community because as they transition out of business, that means a new one won't be able to come in. You're reducing the availability. So a density ordinance has power and it works. But if you can't get a density ordinance, what can you do? So then you start saying, well, we see these high rates of consumption. How do we begin to affect availability in a way that may restrict the access to and availability of alcohol? So maybe you say, all right, we can't do the density ordinances, but what we can do is potentially close these stores instead of at 2 a.m. or 3 a.m., corner stores 2 a.m., 3 a.m., we can close them at 12 or we can close them at 11. So you're looking for the core principle that drives the problem rates in these best practice interventions. In the case of RBS, server training, that is fundamentally about ensuring that servers are mandatorily required to get training and that training occurs over a specific period of time. But the evidence also suggests that training is most effective when you have quarterly compliance checks. So when you're looking at this, you're going, well, all right, we need to do RBS and we need to do this training. Training once every 5 years isn't really best practice, so we can't do that. But we're preempted from requiring when they can get the training, so we can't do that. But what we can do is ensure that these businesses are subjected to the other piece of this policy, which is compliance checks. And compliance checks is a very powerful intervention that then encourages the business to get the training because they're getting checked every quarter. So this is just a couple of examples of how reading the evidence behind the policy, or talking to people who understand that evidence and consulting with them as you're thinking about it, particularly ANOC. ANOC, alcohol no ordinary commodity, gives you a lot of this information, helps you tease out the core principles so that when you're testing whether the policy you are pivoting to is strong enough, that will give you some guidance.
Thank you so much, Michael. And I encourage folks continue to put your questions in the chat and in the Q&A box. Let's move forward. And Ryan, I'm going to pass it back over to you.
All right, great. Thank you. And as we start to get into the fact sheets here, we've done a lot of talking about how you would use the fact sheets and what that means and pivoting and that sort of thing. And like to quickly here pull up, sort of walk you through this, but also have you thinking about this, that we have a question that we'd like you to answer and see, the sort of an example of what we're thinking here. Let's look here. Sorry, I just was trying to jump down in what my notes were here. Okay, so let's imagine here we got a couple considerations when it comes to preemption, and we have a state that is the sole body that is responsible for granting and revoking licenses. And say you have a bar, you have a whole bunch you want to stop new bars from coming into town. What can you do to prevent that? And so this is a question of, we know that the state is the sole person that does the granting and revoking of licenses. What can we do at the local level? Are we preempted? Can we go ahead and do this? So what can we do? So thank you. I see people putting in their answers, and I'll say sort of start to give a little bit of the answer away. Oklahoma is one of such jurisdictions where they are strongly limited as to what they can do with regard to issuing a local license. But again, preemption is very specific. It's a local alcohol license that they are preempted from giving. So let's start to get into this and start to look at the answers here. So local policy on granting new licenses is not preempted. That is not correct, because here the state is the sole authority with regard to giving alcohol licenses. But again, we're talking specifically about alcohol licenses. Option number 2, this one on its face looks like a good one, looks like the actual answer. However, here we're saying we can't do anything. Yes, it is the state, you're preempted, but we've been talking about the ability to pivot. And so ultimately, option number 3 is the way to go here. And the reason for that is there's always, as Michael was saying, other opportunities, other ways to get at the problem here that we have. We want to prevent new bars from coming in. What can we do in addition to or other than preventing their local liquor license from happening? At the local level, in most states and most local jurisdictions, cities and counties have a lot of room around land use and zoning. Potentially in this instance, you could look to those powers to prevent change, what uses are allowed in a certain area and prevent new businesses from opening there. Specifically, and oftentimes too, you can specifically call out bars as being something that's not allowed in that zone. Other spaces that localities have a lot of authority is often in the realm of what are called police powers. Not, this doesn't necessarily mean law enforcement, but just as in you're able to regulate sort of for the good of your community what's going on there. That also falls under there is like nuisance activities. So say you have new bars and there's a lot of problems around, entertainment. Potentially you could regulate nuisance through prohibiting them from having an entertainment permit, or similarly, put requirements on these facilities that are tied to a different type of permit, such as an occupancy permit. And so if they fall out of compliance with these policies that are inherent to the authority that are allowed at the locality, you can start to address the problems at these locations. So the fact that the state is the sole arbiter when it comes to issuing an alcohol license, there are other licenses potentially available or other things that the locality can do. So that's what we're talking about when we're talking about pivoting to another space. So, and now let's get into briefly talking about what is in the fact sheets here, that there's one for each state. Before I describe the categories of the policy interventions included in the fact sheets, how many of you are familiar with the 4Ps? Possibly you've heard of it in the context of tobacco regulation. It is also an important concept to remember when working on alcohol policy. The 4Ps in marketing are product, place, price, and promotion. The sale and use of alcohol are strongly affected by environmental conditions commonly executed through influencing the 4Ps of marketing. Public health professionals can use the same strategies to change environmental factors that influence behavior and therefore thereby improve health outcomes. These 4 categories in the fact sheet seek to address one or more of the P's. These categories should be viewed as neither exclusive nor exhaustive. Similarly, the policy interventions listed within them, again, are not exclusive nor are not an exhaustive list of all the policies that are available out there. The first one is social access to alcohol category, which covers underage access to underage drinking parties, as known typically as social host ordinances. The alcohol retail category covers 2 policies. The first one is licensing, and this describes whether a locality has authority to issue as well as revoke and or suspend licenses for alcohol retailers within their boundaries. So that one should sound rather familiar. And the second policy is zoning and nuisance ordinances, which describe whether localities, through their ability to regulate uses within their boundaries and the use of police powers to regulate nuisance, can impose standards on how alcohol retailers operate. Alcohol pricing covers 2 policies, one which somebody here is actively considering. The first is alcohol sales taxation, as in whether localities can directly impose local tax on the sale of alcohol beverages specifically. We're not talking about sort of taxes, sales tax generally. The second one is happy hour regulation, specifically whether localities can restrict happy hour sales, which typically promote lower priced alcoholic beverages during certain hours of the day. And the last category we have here is alcohol promotion, which describes local authority to regulate billboards in a jurisdiction, as well as limits on window advertising at alcohol retail locations. And with that, I'll hand things over to Katie.
Thank you, Ryan. So I think some of you are here for is these are the fact sheets that we've put together for you all. And I may have misspoken earlier, but you will have these in your inbox by the end of the week, I will say, but within a day or so. There are fact sheets. There's an individual sheet for each state. So you will see that the sheet itself has all of the details for the state that you are in. The first page has an overview and an explanation of preemption. Some states also have an extra consideration of Dillon's rule, which is not preemption, but does interact with some of these issues. So there's an explanation of that on the applicable states. And then each sheet has 4 tables that cover those different categories that Ryan was just discussing, and I'll show you one of those in a second. So the tables are for social access to alcohol, alcohol retail, alcohol pricing, and alcohol promotion. Each policy has a citation right there. And so if you're using these online, you can actually click right on it and it will bring you to your state's statutes. So you can take a look at those. It also is a great tool. So if you're worried about statutes that have been updated, you'll be able to see the year on those when you click. And then on the last page of the fact sheets, there's some more information about how to get in touch with us. As you've heard through these conversations, there's a lot of this that is not just, can you do this, yes or no, but rather how do we start pivoting through and how do we think through what the options are available. And so the TA that we can provide through both the PTTC and through SPTAC can help you start thinking through those pieces. So here is what the tables look like. This one is from New Mexico, and this is the alcohol retail table. And you'll see under each one, there's a couple of different types of policies that statewide policies that fall in. So under alcohol retail, there's information on both licensing and then zoning and nuisance ordinances. The licensing in New Mexico, the state is solely responsible for providing licenses, and licenses can be suspended or revoked for violation of any provision of the particular statute in New Mexico that grants those licenses. In both cases, the local options for taking action are not direct. So you could also say in this case that local entities are preempted from directly taking action around licenses. So we provided some ideas for what you can do if you're looking for local options on this topic anyway, right? So as you've heard already in this time together, the thing that we would recommend for you to do in this case is explore local policy options, both in your state, but also in other states to see if there's something that will address this problem. If you look down to zoning and nuisance ordinances in New Mexico, there is no statute that limits the local authority over zoning or nuisance ordinances. So you may have the opportunity to place conditions on businesses to prevent alcohol retail establishments from entering the community and for ensuring that those who do operate do so in a manner that reduces sales to minors and outlet-related violence and nuisance. So this would be that example of maybe we can place a noise ordinance in this area where the local bars are located, right? Rather than going directly at the licenses of bars there. So as we sort of wrap up what we've covered so far today, we've talked about preemption analysis as one step in the building readiness for policy work in general. We've really focused on this idea that preemption answers the question, who gets to decide whether or not we can do this policy at the local level? And we've started to look through some ways to use those preemption and alcohol fact sheets. In the couple of minutes that we have left together, I'd love to have folks place in the chat, what is one thing that you've learned today in this hour together that you are going to take back to your work? And while we do that, I will say we want to hear from you. Just now that we're starting to have these conversations, we've gone through this, how many of you are really thinking about a policy to address the local condition problem that you've identified in your area? And I see at least one hand raised and only a few people are on camera. But also feel free to put that in the chat as well. And then now we have a few more minutes for questions for us. So what's coming up for you? What questions you have? Please feel free to unmute yourself and jump in. And at the same time, I'm seeing some of these great takeaways coming in the chat. No questions. You feel 100% prepared to go out and implement all of your policy ideas.
I just really appreciate the thought of if one thing isn't, like, if there's a roadblock, then we don't give up. We look for what we can implement with partners, because sometimes it can get discouraging and so I really appreciate that content.
Yeah, can I add to that? I think that's a really important point. Where we often get stopped in this notion of no pivot option is we may have worked on, as a coalition, on developing, the core elements of a responsible beverage or server training policy you want. And you take it, you need some legal feedback from the jurisdiction. So let's say it's a city, and you find your champion on the council, and the council member takes it to the city attorney. And the city attorney says, we can't do that. Period. End of discussion. You're done. And most coalitions at that point go, oh, damn, what are we going to do? And the truth is, you probably know more about server training because of the work you've done than that city attorney does. You probably have a better idea of what's out there. You have a better idea of what works. You have a better idea of what other communities have done it. So often when you get into the county government, the city government, and you ask questions of the attorneys who are paid to protect the city from lawsuits, the first answer is no. And Ryan mentioned this earlier. Is it a political no, or is it a preemption no? So even this notion of not giving up and pivoting, a no from an attorney is not a no. It's just I got to look harder.
Mm-hmm.
Yeah, no does not always mean no. That's right. At least here.
That's what I'm seeing mostly in the chat. The two things that I'm seeing rise up are this notion of pivoting and finding a way to do what you need to do, and also looking to see who else is doing the work. We have some more space for questions, and as we do that, I'm just going to pull up on the screen our evaluation. So we do really value your feedback. It helps us shape what we're able to bring to you and how we present the information. So if you are able to, we'd really appreciate you can either scan that picture on your phone or the link is in the chat as well. And I see in the chat, in the past, we've worked with the DA to find ordinances that would work when a municipality doesn't want to enact a social host ordinance. I love that. And Michael, did I cut you off? I'm sorry.
No, I was just going to ramble on about something. It's not important.
I'm sure it isn't.
I do that all the time.
Wonderful. Well, and being aware of everybody's time, we're here for the next few minutes. Please hang out and ask questions. But thank you so much for joining us. It was wonderful to see you all today.